Hi everyone, and welcome to Premium Health Tips. Today, I'm going to be talking about why night owls may have a higher risk of type 2 diabetes than early birds. Type 2 diabetes is a chronic condition that affects how your body turns food into energy. Night owls are people who prefer to go to bed and wake up later in the day. They may also have a harder time falling asleep and staying asleep at night. There is some evidence that night owls may be at a higher risk of type 2 diabetes than early birds. When your body's natural rhythms are disrupted, it can lead to changes in metabolism, insulin sensitivity, and appetite. These changes can increase your risk of developing type 2 diabetes. This is because night owls tend to have less regular sleep patterns, which can disrupt their body's natural rhythms. It is caused by a combination of genetics and lifestyle factors, such as being overweight or obese, having a family history of diabetes, and being inactive. Does being a night owl increase risk of developing type 2 diabetes? Share on Pinterest, does being a night owl increase your risk of developing type 2 diabetes? Milla Studio/Stocksy. Night owls are 54% more likely to develop unhealthy lifestyle habits, according to a new study. As a result, the study found that they are also 19% more likely to develop diabetes. One may become an evening chronotype due to genetics or as a response to lifestyle choices or working conditions. By retraining the body, one may change from a night owl to an early riser. Being a night owl is associated with a greater incidence of type 2 diabetes, according to a new study from Brigham and Women's Hospital in Massachusetts. The study found that people who go to bed late and get up late are 19% more likely to develop type 2 diabetes than early birds after considering all socio-demographic and lifestyle factors. The research focuses on chronotypes, the time of day one gravitates toward. So-called morning people have a morning chronotype, while people who prefer the evening and night hours have an evening chronotype. The study involved 63,676 nurses from the ages of 45 to 62. Each participant filled out a questionnaire every 2 years from 2009 until 2017. None had a history of cancer, cardiovascular disease, or diabetes at the study's outset. Of the participants, 11% described themselves as having a definite evening chronotype, while 35% said they had a definite morning chronotype. The researchers also considered an intermediate chronotype for people not strongly associating with the other chronotypes. Evening chronotype people were 54% more likely to have unhealthy lifestyle habits, including smoking, inadequate sleep duration, higher weight and BMI, lack of physical activity, and poorer quality diet. Before factoring for socioeconomic factors, shift work, family history of diabetes, and several of these lifestyle habits, especially high BMI and low physical activity levels, the risk of diabetes for people with an evening chronotype was much higher at 72%. This suggests that these factors, as opposed to an evening chronotype itself, may have much to do with the higher incidence of diabetes. The study and an accompanying editorial are published in the Annals of Internal Medicine. Join fellow subscribers in receiving our weekly diabetes email for actionable tips on eating wisely, news on research breakthroughs, and more. It is possible that life course circumstances or types of work serve as a common cause for both chronotype and lifestyle, said Dr. Lin. One's chronotype is also likely to be individualized, said Dr. Stephen Mallon, Associate Professor of Metabolism and Endocrinology at Rutgers University. I think most would say it's generally more a range from a practical perspective. Example, could be morning hours, mid-morning to early afternoon, late afternoon to early evening, said Dr. Mallon. He suggested that it could relate to some extent on matching up the internal clock of the body with the clock society functions off of each day. This, he said, is referred to as circadian entrainment. Dr. Mallon added that morning chronotypes are generally better at activities about 5 hours from waking, compared with evening chronotypes, who might need closer to 10 to 12 hours. It's not really known why evening chronotypes prefer some of these behaviors, explained Dr. Mallon. As individuals engage in waking up later, moving later, and or eating foods later, their body gets entrained to this. The mismatch of behavior with circadian biology predisposes one towards greater storage of these nutrients, which may increase obesity risk. Dr. Mallon. In his research-trusted source, Dr. Mallon has found that evening chronotypes have a host of risk factors not shared by their morning counterparts, including greater insulin resistance, higher blood pressure, and heart rate levels when performing daily acts of living up to intense exercise, as well as using less fat for energy. Dr. Mallon linked eating later in the day to an interruption in sleep such that it becomes a vicious cycle of poor sleep and behaviors promoting disease. Some, he noted, refer to the disconnect between the body's need for, or want of, sleep with one's actual wake-up time as social jet lag. The result is a stress response called the hypothalamic pituitary adrenal axis that promotes neurologic activity favoring wanting. The later in the day desire for certain foods or substances, such as sweet/fatty foods or cigarettes, align with the neural circuitry and supports the behavior and feels good. What the authors may have measured, said Dr. Lin, might in fact be the effect of lifestyle and other factors related to lifestyle, such as psychological factors and type of work, example, outpatient, inpatient, or ICU nurses, rather than the direct effect of chronotype on diabetes. Dr. Mallon considers chronotype genetically based, though Dr. Lin envisioned future research that might investigate the differences between those who are naturally night owls and those who become one for other reasons. Dr. Mallon suggested that to shift one's chronotype, consider stimuli that might put one's body on a healthier schedule. Light, he pointed out, is a main driver of central nervous system regulation of the body, and behaviors such as feeding and exercise impact our peripheral clocks, example, muscle, liver, intestines, heart, etc. Dr. Mallon proposed retraining our bodies with such cues in mind. An evening chronotype trying to become a morning person might consider waking up 15 to 30 minutes earlier when it is still daylight, eating breakfast, and moving a bit more in the morning. They might try avoiding food and physical activity at night, lower bright lights earlier, and try to get to bed 15 to 30 minutes earlier. Thank you for watching this video. I hope you found it helpful. If you did, please give it a like and subscribe to my channel for more health tips. You can also share this video with your friends and family. I appreciate your support. Thank you for watching my video on how to get rid of neck pain at home in 11 minutes. I hope you found it helpful. If you have any questions, please leave a comment below. And don't forget to subscribe to my channel for more health and wellness tips. In the video description, you can find links to purchase products for 2 diabetes.